So today the topic of discussion is antihypertensive drugs. The drugs which decreases the hypertension means decreases the blood pressure. This is very important topic. So first of all, we classify these topic. The first classification is diuretics. Diuretics we know which increases the urine formation. By this it decreases the blood pressure. Example is thiazide, or we can say the potassium sparing diuretics. This is the separate class in fact, and we studied in the excretory system. Second is sympatholytic drugs, which decreases the sympathomimetic activity. These classes are beta blockers, alpha blockers, mixed blockers, adrenergic neuron blocking drugs, or centrally acting agents. In beta blocker, example are atenolol and propanol. Here the suffix is lol, lol. In alpha blockers, the examples are prazosin, doxazosin. Suffix is sin. In mixed blockers, example is labetalol. In adrenergic neuron blocking drugs, example is razerpine. In centrally acting agents, example is methyl dopa. Third class is calcium channel blockers. Examples are verapamil and diltiazem. They are the very important examples. Fourth class is ACE inhibitors. We know ACE, angiotensin converting enzyme inhibitors, and the examples are captopril, fosinopril and benzapril. Here the suffix are pril. The fifth class is angiotensin 2 receptor antagonist. Examples are losartan and aprosartan. Suffix is sartan. Now sixth important class is vasodilator, which dilates the blood vessels. Examples are nitroprusside and hydralazine. This is the separate class and they discussed in the vasodilators topic. This is the schematic representation of these three important classes, how they decreases the blood pressure. So the first we discussed about the diuretics, how diuretics decreases the blood pressure. Suppose if we have increasing the blood pressure, and by using the diuretics like thiazide or potassium sparing diuretics, they decreases the salt and the water retention. By decreasing the salt retention, in order to maintain the osmolarity, water also goes outside to maintain the osmolarity. By doing this decreases the blood volume, and by decreasing the blood volume and ultimately causes the decreases blood pressure. Now the second MO is vasodilator. Vasodilative examples we know verapamil and diltiazem, very important class, in fact discussed in the next class. This causes the decreases the vasoconstriction. The blood vessels which are very constrict blood vessel causes increasing the blood pressure, and by giving the vasodilators, they relaxation the wall of the blood vessel. By doing this, they decreases the total peripheral resistance. Where peripheral resistance means the force of the contraction acting on the walls, there is decrease. By the decreasing the force of contraction, ultimately decreases the blood pressure. Third important class is beta blocker. We know the beta blocker receptor, in fact beta 1 receptor present in the kidney and in the heart. Beta 1 receptor present in the JG cells of the kidney. JG cells means juxtaglomerular cells of the kidney. This is the normal cycle. Angiotensinogen, which is plasma angiotensinogen, converts to angiotensin 1 by renin enzyme, and by angiotensin 1 it converts to angiotensin 2 by ACE, angiotensin converting enzyme. Angiotensin 2, it has two receptors, 81 and 82. 81 receptor presents in the adults and 82 in the fetuses. This angiotensin 2, it works as increases the peripheral resistance, means increases the force of the contraction on the walls, and increases the aldosterone. By doing this activity, it ultimately decreases the blood pressure. So if we are giving the beta blocker which will act on the kidney and JG cells, it will decrease the renin. What renin cause? Renin cause the decreases the angiotensin 2, and angiotensin 2 decreases, which decreases the activity of the aldosterone, and aldosterone causes the decrease in the salt and the water retention, means the sodium or potassium with these ions or the salt, they decreases. And again, in order to maintain the osmolarity, water always goes wherever the salt goes, so decreases the blood volume and ultimately decreases the blood pressure. And the beta blockers, how it acts on the heart. Beta 1 receptor present in the ventricular wall of the heart. It decreases the force of the contraction of these walls, and by this decreases the heart rate. Decreases the heart rate and decreases the contraction, ultimately decreases the cardiac output, and cardiac output decreases, which leads to decrease in the blood pressure. The action of sympatholytic drugs, we discussed about in classification that there are many classes: beta blockers, alpha blocker, mixed blocker, adrenergic neuron blocking drugs, and centrally acting drugs. So we have discussed that beta blockers, beta 1 receptor present in the JG cells of the kidney and the heart, and examples are atenolol and propanolol, and I have told that suffix is lol. Second major class of sympatholytic drug is alpha blocker, alpha adrenergic blocker. By we know alpha 1 receptor present in the arteries and the veins. Alpha 1 receptor present in the arteries and the veins. What alpha 1 receptor do? What alpha 1 receptor causes the constriction, means contraction. The blood vessel constrict by the alpha 1. So by giving the alpha blocker, it causes the relaxation of both arteries and venous smooth muscles, because the contraction which will caused by the alpha 1, it will be inhibit, so there will be relaxation of both arteries and venous smooth muscles. Decreases the peripheral resistance, means force of contraction will be decreased, and causes the decrease in blood pressure. But here is specific thing, that there is minimal change in renal blood flow, glomerular filtration rate, and cardiac output. Means these three things, it will remain unaltered but decreasing the BP. These are the drugs which act as alpha blockers: prazosin, doxazosin, and terazosin. The suffix is sin. Now the third class of sympatholytic drug is mixed blocker, means it will act by alpha blocker as well as also beta blocker. So it has combined action, alpha and beta adrenergic blocker. Primarily by blocking the alpha receptor, it decreases the BP. Means blocking the alpha receptor in peripheral blood vessels. We know the alpha receptors present in the arteries and the veins. In the peripheral blood vessels which are present having the alpha receptor, by blocking this causes the decrease in the BP. By doing this activity, heart will compensate. It will not want that the blood pressure will be decreased, so it will increases the peripheral vasodilation. And we know it has mixed action, so also act as beta 2 receptor will be blocked, and it will prevent the cardiac compensation, means no peripheral vasodilation. Now the fourth class is adrenergic neuron blocking drugs. This is a diagram. For example are the reserpine and guanidril. In reserpine, this is the cytoplasm, neurotransmitter. This is the synaptic vesicle. So neurotransmitter which is present in the cytoplasm, it is transported to the synaptic vesicles through a specific enzyme. Neurotransmitter, it is transported to synaptic vesicle through this enzyme, vesicle monoamine transporter enzyme. By adrenergic neuron blocking drugs, means the reserpine, if we giving the reserpine, it will inhibit this enzyme, vesicle monoamine transporter. So no neurotransmitter will not be transported to vesicle. So by inhibiting the VMAT, yani vesicular monoamine transporter, neurotransmitter will not be transported to the synaptic vesicle, and if not transported, then it will be metabolized by the metabolic enzymes. So for example, if the neurotransmitter is catecholamines, adrenaline or noradrenaline, it will be metabolized by the MAO, monoamine oxidase enzyme. Fifth class is centrally acting drugs. For example, methyl dopa. By knowing this MOA, we should know that alpha 2 receptor present in the CNS, central nervous system. So methyl dopa enters the CNS by enzyme dopa decarboxylase, important enzyme. It converts to alpha methyl dopamine, And alpha methyl dopamine, it converts to alpha methyl norepinephrine by enzyme dopamine beta hydroxylase. This alpha methyl norepinephrine, it acts as false neurotransmitter. If it's a neurotransmitter, of course it will act on the receptor, so it acts on the alpha 2 receptors present in the CNS and blocks the norepinephrine release. By blocking the norepinephrine release, it causes decrease in the vascular resistance and ultimately decreases the blood pressure. So we already discussed about the sympatholytic drug actions. Now the third major class of antihypertensive drug is calcium channel blockers. Important examples are verapamine and diltiazem. So how it acts? It acts as the negative inotropic effects. What does it mean, negative inotropic? It means decreases the force of the contraction. Inotropic means force of contraction of heart will be increased. So negative action, it will inhibit the force of the contraction. So no movement of the calcium 2 plus in arterioles. We know the Ca2 plus, it acts as the constricting agent. So if no movement, no constriction, and there will be relaxation of the arteriole smooth muscles. By relaxation, decreasing the peripheral resistance means the force of contraction will be decreased by the walls and ultimately decreasing the blood pressure. The fourth important class of antihypertensive drug is ACE inhibitors. This is the normal cycle we already discussed, but angiotensinogen, it converts to angiotensin 1 by renin, and angiotensin 1 converts to angiotensin 2 by ACE, angiotensin converting enzyme. The normal one action is angiotensin 2 causes increasing the peripheral resistance and increasing the aldosterone by acting on the ROS, renin angiotensinogen aldosterone system. By doing this, it increases the blood pressure. So if we are giving the drug captopril, it will act on the ACE, inhibit the ACE activity, and all these steps will be stops. It means the normal cycle was the increasing the blood pressure. By giving this drug, it will decreases the blood pressure. So we want angiotensin 2 receptor antagonist. It is the fifth class of antihypertensive drugs. Examples are the losartan, apraglutide. This act on the angiotensin 2 receptor. So there will be no action of angiotensin 2. This angiotensin 2, which we know that it increases the peripheral resistance, increases the aldosterone, and ultimately increasing the blood pressure. So by inhibiting the angiotensin 2, there will be decreasing the blood pressure.